Hello, and welcome to a special edition of Up Close on METV. I'm Charles Clapsaddle, Station Manager for Manatee Educational Television. And it's our great pleasure to have with us today Dr. Gus Arrojo, who's going to talk a little bit about not only his background and his years as a physician in our community, but also about some new and innovative healthcare procedures. Dr. Arrojo, thank you so much for joining us.
Thanks for having me.
It's really such a pleasure to have you here, having the opportunity to talk with you before. Not only are you well informed and very knowledgeable, but you bring a great wealth of experience and knowledge to the medical field. Thank you for joining us.
Well, thank you very much. It's very nice words, very kind.
Now, you've been a physician here in Manatee County for how many years?
We relocated to Manatee County in 1996.
Well, you're considered a long-time
I'm an old-timer now. I'm an old-timer now, yes.
Well, tell us a little bit, where'd you come from? You know, what brought you to Manatee County?
Actually, what brought me to Manatee County is a very interesting story. We were living on the East Coast, and my wife was in banking for many years. And there was a postcard for Anna Maria Island, one of the hotels there, and my wife said, oh, let's spend the 4th of July there. We came down on the 4th of July. I'm sitting there, and I said, you know, one day we're going to live here. And 7 years later, it magically happened. But that's where we wound up in Manatee County. There was one of the local physicians here in town, was a nephrologist, Dr. Palomino, which I had gone to medical school with. And I didn't even know he was living here at the time. Everything came together. Everything just came together.
Well, you know, that's a perfect endorsement for the Tourist Development Council. So you saw a postcard, brought you to.
Exactly.
But where was your roots? Where did you grow up? And
rumor has it I was born next to my mom in Havana, Cuba.
Really?
Yeah, and I came to the United States at age 8, and then my parents moved up to New York and lived in the New York suburbs, and that's where I had my formal years, my formative years, and we lived in White Plains, New York, and then when I was in my late teens, my parents moved to Florida, and I lived in South Florida till in my 20s, and then life began, you know, finished college at the University of Miami, went to college at the University of Miami, and then I went off to medical school. I went overseas, wound up graduating from the Dominican Republic, and then came back to Florida. And along the way, things changed. I wound up working in industry, moved to New Jersey, of all places, and yeah.
Well, a big change after spending a few years in South Florida to go back to New Jersey.
Yeah, my wife still loves it up there. She said, why don't we move back to Jersey? Yeah, it was actually very nice. And so I worked for a pharmaceutical company based out of New Jersey. And that was, it was interesting. I did put about 10 years there and did a lot of things within the system. And so I have an understanding and a feel for what medicine is like from that end as well.
Well, pharmaceutical is, is a major industry, and, there's lots of research and development, marketing, and sales for those things. And we want to talk a little bit about that. But if we can go back just a little bit about, what prompted you to want to become a physician in the first place? Here you are, you're going to the University of Miami, a beautiful city, and did you always have a natural inclination to want to go into medicine?
It's actually on the way over here, I was thinking about that, and as far back as I can remember, I wanted to be a doctor. I'm 6, 7, 8 years old, and then that kind of morphed along the way. At one time, I wanted to be a doctor and a chef. I cook.
We'll talk about that later.
Yeah, I cook. So I kept my word. But so I wanted to do. For a month, I wanted to be a priest. Then I discovered girls, but I never forgot about medicine, and that was sort of like the driving force. I always wanted to do that. I was just.
So you had a calling, to be a physician.
That's what they claim, But I always had that desire, and anything that was medically related, I read about it. I loved science, and it was just a natural progression.
So, when you went through medical school, and obviously, there's an internship and a residency and things. Did you feel that there was a certain area of medicine that was more attracted to you that you were inclined to?
It's interesting because, again, as we embark on a venture, you come to so many crossroads, and you wind up taking different roads, and sometimes you don't even know the rationale, but it just happens. I had an interest in pediatrics at one time, and I wanted to be a pediatrician. And then, the desires changed. I went to work for industry. And then once I got into industry and saw and was involved in the development and the structuring of clinical trials, et cetera, internal medicine was what really drew me to the forefront.
To focus on that specialty.
Adult medicine, yes, because internal medicine is the core for all the specialties. So before you're a cardiologist, you have to be an internist first. So that's sort of like the first step in getting ahead in any subspecialty. So I decided to do that. And by that time, I was a little older. I was already married. I had children. Like I said, I had a wife and 2 kids with a nasty habit of eating. So I couldn't be a student forever. I had to go out and start
in the world
and get to the real world. So my personal interest is actually endocrinology. And
tell us what endocrinology is.
Endocrinology is the study of hormones and glands. So the diabetes, thyroid disease, and just hormonal issues and problems. That's really what I enjoy doing. And if I would have pursued that, I probably would have gone into endocrinology. But life kept me as an internist, and I still practice some degree of endocrinology because I take care of a lot of diabetics.
Absolutely.
I take care of a lot of issues that are endocrine related. So, it's sort of like the best of both worlds.
So as you came here and you obviously started to practice with other physicians, and you began your career as an internist. What were some of the challenges that you saw as a physician in working with people as an internist?
Well, the biggest problem was education and getting people to understand their disease processes and connecting the dots. If I eat this, it's going to affect my blood sugar, and try to modify behavior, which, as we know, is not an easy thing. So that was one of the issues that probably was the hardest, because you're trained, well, you do this, you write this prescription, you put people on the plan, and everything magically happens, and it doesn't work that way. So it's fascinating, though, because you get to understand people, how people think, and how you can improve the quality of their life with sometimes very simple suggestions. It's rewarding.
Well, I would think too, as a physician, and please, I want you to hear your opinion. Is as a physician, you'll see people, when their condition is already exacerbated.
Correct.
Whether it's diabetes or high blood pressure or whatever the condition may be, and you've always been a proponent of, like education and outreach, and say, if you don't do this, this is not going to be the result then.
Correct.
So, that's a big part of it. So, as an internist, you're always kind of treating the condition as it's already occurred.
Correct. And that's one of the, in a roundabout way, one of the downfalls of Western medicine. And that's one of the reasons I gravitated to alternatives and holistic modalities, because in that framework, it's all about prevention. Once the system is broken, you don't want to get to that point. So everything is geared to avoid that situation. And it's integrative, because you borrow the best from both worlds. No system is perfect.
Right.
So whatever works in the given system, you can combine them, and you can enhance the effectiveness of either or both. Well,
one of the great things, and I'd really like to, our audiences to know a little bit more about it, is, you're a physician, trained in science, through medical school, very involved and engaged, but at the same time, you have this kind of open and engaged perspective on other modalities, as you said, to help people. And that's, the key thing for physicians, is to help people. So tell us a little bit about how that holistic approach came to evolve for you.
Well, it's several things. Life puts things in your path, and there are obstacles that you have to overcome. Trying to find resolution to personal and family issues. It's very frustrating when someone comes to me as a physician and I have nothing else to offer them. So they've been to 2, 3, 4 different doctors. They're still having their problem and it's not resolved. And my wife will attest to my stubbornness. I never take no for an answer. So I say, there has to be an answer. There has to be, you know, and if people are open to look in another door, why don't we try that? So with, I actually went through a personal health crisis years ago, and I was quite sick. And that really opened the door for me to try to fix myself, and I did. And if I could fix me, I could fix you. And that was sort of, it wasn't the beginning because I was already there, but that gave me the conviction to kind of step out and say, hey, anybody that challenges, you know, what I'm saying or what I'm doing, let me show you my medical record, and look what I did.
And I think that's a remarkable thing. As you said earlier, no system is perfect, but a combination and an exploration of other methodologies, can be very beneficial. Give us, in kind of a nutshell, what holistic medicine is. How would you define that?
Holistic medicine is the concept is you're looking at the whole, mind, body, spirit. You're not just treating a gallbladder. You're not just treating a liver, or or a heart. You're treating the person. You're treating the human being, and in that goes in the social and also the spiritual component. And through, again, a series of things, I wound up in acupuncture. And acupuncture in its pure sense has a huge spiritual component to it. Not the acupuncture that's being practiced in China, by the way. That, what they call TCM, is an aberration that malmorphed. The original acupuncture is quite spiritual, and they have acupuncture points that have like spirit gate and heavenly this, heavenly that. So the ancients realized that there is something higher and above our physical existence that we need to tap into in order for our bodies to be healed. And holistic encompasses that concept, the mind, body, and spirit. I can tell you right now from my personal experience dealing in the acupuncture realm that many individuals, specifically women, that have pain syndromes have been exposed to some level of abuse in their life. And when you
that's kind of like even a subconscious level.
It's definitely a subconscious.
There, and then that pain kind of manifests itself.
And the irony, and this is my personal experience, and my colleagues may disagree with me, but my experience has been, we read and we talk about psychosomatic medicine, right? But then when you try to implement that, they say, oh, that's quackery, that's crazy. No, that, you have to take this pill to do this. You need to get to the root of the problem. Why is a person behaving in this fashion? That behavior was fueled or triggered by a life event. And it's, a classic example, let's say a woman who has been sexually abused in her youth, and she was an attractive woman. Well, if she lets herself go, and she no longer sees herself as attractive, she is preventing herself from an attack. I have actually seen several of these cases. So it's quite fascinating. You start to get to the root of what is happening. Sometimes pain is just because there's trauma.
Correct.
And like I was involved in an automobile accident in my 30s, and that's what got me to acupuncture and pain management, because I was trying to find an answer to my own pain. Being a physician and being on hydrocodone, it's like an alcoholic working at a bar.
And how difficult is that too? As a physician, the potency
and
of this
dangers,
medicine.
Yeah, and the dangers, and I didn't want to put myself in that situation.
Correct.
And so therefore, I began to look for alternative methods to take care of my own pain. And now, and when I found, I go, well, if I can fix me, I can fix you. And so that's been sort of my philosophy. And I do a lot of non-narcotic pain management, and I get very good results. And in fact, even with my own family members, you know, you're there and they're having pain. So wait a minute, you know, hold that thought. I'll be right back. I'll get my needles and do this and do that, and they go, wow, that actually feels better. You know,
and that's a big part of it too.
Yeah.
Is you know, and I think as a physician, as a caring individual, you know, you want to relieve that pain and stress and feeling that of all the patients that come to you.
Well, you know what? It's like anything that we do. When you wake up in the morning and you have a sense of accomplishment, and you can look at someone and know that, wow, you know, this individual came here and I made a difference in their life. That's what fuels at least me to get up in the morning and deal with the day-to-day drudgery of any profession. You know?
And I would just say, you know, too, that you can see a progression in your patients that's got to be very, not only rewarding for the patient, but you as a physician as well, to see the progression of someone that comes in who has a great deal of pain or trauma, and over a period of time through your services, you can see that kind of evolution and repair.
It's not only do you see it, but it's uplifting. You know, when you have someone who is in horrific pain and you know they're gone, they're no longer taking their narcotics. You know, and like I tell
with all its side effects.
With all its side effects, and I'm not saying there is that they are wrong. I was also a hospice medical director for several years, and that was part of what I did. So the treatment of pain became very, very personal for me. And honestly, when I was there, I never thought that I would give a human being so many narcotics to relieve pain, but they needed it.
Right.
And it's like, wow, this really is what needs to be done. And these folks do incredible work. Exactly. And I did it for several years, and I got away from it because it's actually physically and mentally draining.
I can imagine.
These people you have to give them a lot of credit. They're the ones that do it day to day.
They're at the end of their lives,
years.
and they're in a condition that requires not only attention, but it's also, you know, very sad to see that. And as physician, you know, I would think, you know, you want those people to have as comfortable thing as possible, and whatever that medication is. However, it can be kind of quite demanding on you as a physician.
It's emotionally demanding, you know, when you're dealing with people at that level of pain and the severity of their conditions. But on a positive note, many of these folks, I've had, in fact, there was one gentleman who has since passed, but he was in hospice, and they gave him just a few weeks to live, and guess what? He lived.
That's
he
great.
proved all the doctors wrong.
That's
you know.
Great.
And then when he was discharged from hospice, he goes, I don't have a local doctor because everybody thought I was going to die. Well, you be my doctor. I said, well, I'll be, but you're not allowed to die on my shift. And we became good friends.
Story.
Yeah, we became good friends, and he had end-stage liver disease. But he lived for several years. He lived for several years after that. You know,
so that's got to be a great story.
Yeah,
that's got to be not only a great story, but it's really an indication of the care and attention that you as a physician, you know, want to give to each and every patient. Now, one of the things that, you know, I'd like for you to take some time on, and you've touched on it, is the different aspects of holistic approach to medicine. And you know, you've talked in the past, and I've heard you talk about the many types of things that are available. There's hypnosis, acupuncture, and one of the things that, you know, I'd like for you to talk, because I've seen you talk, and is, you know, what you do with the ear.
And
which is a remarkable story, and it has a rich history to it, and I'd like to hear a little bit about that.
Well, it's called Auricular Ear Acupuncture. And this is, it's fascinating because back in the 1950s, a man by the name of Paul Nogier in Lyon, France, saw patients coming in with scars in their ears. And he questioned them, and they all said, you know, I had chronic pain. I went to see this lady by the name of Marie, who was a gypsy, and she scarred my ear, and my pain's gone. So he goes and he meets Marie, and Marie apparently states that she was taught how to do this by her father, who learned it from this Chinese man. So he becomes fascinated by this situation. Acupuncture had already made huge inroads in France, going back to the 17th and 18th century.
Really?
Because they had colonies out far in the Far East,
Correct.
and they brought that technology, to France. So it was not a new thing for him. Well, he devoted his life to mapping out the ear and locations to take care of problems. And interestingly enough, you turn the clock 15, 16 years later, and the Chinese begin to adopt his model. So now you have, so now you have the traditional Chinese medicine, TCM, looks at auricular acupuncture, and you have Chinese points, and they call them European points. And the European points are Nogier's point. In fact, as I mentioned earlier, in a couple of weeks, I'm going to be going up to Rockville, Maryland, because his son, Raphael, comes to the U.S. once a year, and he gives lectures on auricular acupuncture, and he's Obi-Wan Kenobi, you know? He is the guru. Yeah, so I tried to visit with him, and Raphael and I have actually developed a friendship. He's a very nice man. Yeah, he's a very nice man, and it's fascinating.
Well, and to me, and I want you to share a little bit about this, is that the mapping of the ear and the acupuncture that accompanies it, there's very specific points to areas in the ear.
Correct.
To whatever condition that you're trying to treat, and it's a proven kind of a result-driven type of treatment. And
not only Nogier being a medical doctor, he takes things a step further. So you were able to actually document and monitor increases in hormonal levels by stimulating a certain point in the actual ear. If you look at the ear itself and you look at the earlobe, imagine that your ear is a fetus. Right. And the earlobe is the head, and the feet are headed in this direction. The ear has a bifurcation, a split that you can feel in the cartilage. Those are your legs. This is the spine. And so that's just from the skeletal structure. You can actually see it and duplicate it. Yesterday, for example, I had an individual who's having severe neck pain, and I'm giving him injections, homeopathic injections. And I go, before the weekend, since I wasn't going to see him till Monday, I said, before you leave, let me put a couple of beads in your ear, and this will get you through the weekend, and hopefully you'll be pain-free. And, he was having cervical, so, follow the protocol, find out where the neck is, put a couple of beads there, and he goes, wow, this feels pretty good. Now, what's even more fascinating is that the military is incorporating this. Now there's something called battlefield acupuncture.
Really?
Yes. And they're training their medics to, once they stabilize the individual that's hurt, waiting for transport, they stimulate a number of locations on the ear, and they can reduce the use of morphine in the field by 50%.
That's incredible.
It's amazing.
That's incredible.
If somebody would have said that to me 10 years ago, I go, I can't. It's impossible. How can that be? But when you experience it yourself, when you're able to duplicate it, and you see people that, wow, that actually feels kind of good. It's amazing. Another thing, I'm sorry.
Well, I just wanted to say, and I want you to follow through on that, is that throughout the year there's hundreds of points, or dozens, or however many there are, but points that directly affect things. So you can treat a variety of different things with a variety of different positions within the ear, whatever that condition may be, joints or circulation.
The fascinating thing about the Chinese method of treating the human being is that there is a point for everything and anything. You never have that dreaded comment, there's nothing that I can do for you, okay? And that is the worst thing that a patient needs to hear. that is the worst thing a doctor has to say, because at that point in time, your hands are up in there, I don't know what to do. And there's a frustration by both parties. With either auricular or traditional acupuncture, there's always something that you can do. For example, something as simple as balancing the person. Now, balancing their energy. The Chinese call it qi, the Japanese call it ki, the Hindus call it prana. It's all the same essence with a different name. And it's our life force. And that life force is real. That life force exists because we are energetic, vibrational, electrical beings. Exactly. That's why Western medicine does EKGs. They do nerve conductions. They do EEGs. But in Western medicine, we do electrical activity of the head, but we don't connect that electricity to anywhere of the body. Now, if you know anything about electricity, you look at your house. You have a circuit, you turn this light on, right? Exactly. And that's connected to everything else. There is a master control panel. And if you can access the master switches, you can turn things off and divert that energy where you want it. And that's the beauty of it. You're putting a needle in someone's hand here, and they go, well, how is that going to help me? Well, it's all connected. It's all connected. If I go to the wall and I flip the switch, the light doesn't go over there, it comes over here. So we're just following. It's a good analogy. It's a good analogy because that's how it works. So what they were able to do is actually find out the electrical schematics of the human being, not just nerves. Because qi, wherever blood flows,
it's a flow.
It's a flow. So how they did it, who knows? 5,000 years of trial and error, I think, had something to do with it. That
probably did.
But it's quite fascinating, and I'm sure it started out, some poor guy went out into the field and got impaled, and he goes, oh, wow, that really hurts, but my headache's better.
Well, one of the things that is so intriguing about this is the combination of this holistic approach, which includes a wide variety of things, the acupuncture, and even hypnosis at times, and a variety.
Hypnopuncture.
And there's a whole science on that. But also with Western medicine, for the combination, if there's a medication required or if there is a procedure. And you seem to say that there is that combination of these approaches are the benefit for the health of the patient.
And this is what I tell my patients when they come in, for example, just for a consultation. What can you do for me? And I tell them I'm going to find whatever works on both realms. If you need homeopathic injections with acupuncture, we can do that. But you may need in the interim to take this medication, this painkiller, to give you relief. And then we can cut back on it. Or like I tell folks, I have a 70 to 80% success rate, which is quite high. But let's define success, okay? Because by definition, it will be very different than yours.
Exactly.
But I tell them, obviously, if your pain is gone, that's success.
Right.
If I'm able to reduce your medication by 50%, whatever it is, that's a success. If I can get you off a narcotic to a non-steroidal, that's a success. From a non-steroidal to just Tylenol, that's a success. So everybody has a different level of success.
Right.
Have I had failures? Of course.
Yes.
It's not going to work.
It's an imperfect,
The world's imperfect. If the life were perfect, I would have lots of hair right now, like yours.
You look great, though. You look great.
You look marvelous, right?
But one of the key things, and if I may say so, is that not only do you bring like this open and engaged mind to it, but there's also a sense of a real caring and dedication for your patients. And that probably is a combination of life's work to do that. How important is it for you as a physician to have that connection with that patient, to know, because people go to the doctor, they don't know, they're scared, they're unsure or anything. But it seems to me, Dr. Arrojo, that you really bring a kind of a genuine dedication and true care to that patient, who, whatever the condition may be.
I think part of it's my personality, because you can't mold and change people. I was born this way, so I've always been a people person, and maybe that's why I chose this profession, or it chose me. But you're always told from the very, very beginning, you know, going through your medical, you can't identify with the patient. You have to stay here. And, you know, there's some folks that have been my patients or that are my patients that, you know, we consider each other's friends. We don't go out and socialize, but there is that bond.
Exactly.
You know, I get kissed by more little old ladies than you could, you know, my wife says, yeah, you're a senior citizen magnet. You know? You know?
But what a great tribute to you, you know, to make that kind of connection that people not only have a trust, but they also have this kind of like connection with their physician.
And I think for me it's important. That's the frustrating part of medicine these days, where everything is regimented. You have to be, you know, here, and you kind of lose the beauty of medicine, where there's one family in particular. I took care of the matriarch, and she has passed. Then I take care of her son and his wife, and their daughter and her husband, and so you see all these generations, and that was the beauty of, you know, being the local doctor in a small town where you knew everybody and you understood, and there's a lot to be said for that, because you know, talking about getting a medical history, I already know what his father or his mother had or her mother had, and but it's a bond. It's very unique. And we don't get enough of that anymore, because everything is dictated. Well, I'm no longer on your plan, so you know, they go somewhere else. So medicine has suffered as a result of that, and there's a lot of frustration because of the system. You know,
and I would think too, and you know, is that, you know, if somebody works in any medical thing, you are at basically the mercy of that physician or, you know, that healthcare professional who's providing it. And people, when they need help, they're at their lowest type of thing. And, you know, having that positive, can-do, we can help type of attitude and that connection is got to be so rewarding for any patient and any facility that they go into.
You know, and again, some people don't like that. You know, I've had people that have come to see me and left because I guess I'm too touchy-feely, you know, really.
You're too nice.
Yeah, you're too touchy-feely, because it's like, okay, this guy's actually smiling and this and that, but you can't please everyone.
That's true.
This is the reality, but, and like I tell folks, I try to surround myself, the people that I take care of, I like as human beings, okay? If you come to my office and I don't like you as a human being for whatever reason, I'll be the first to say, you know what, maybe I'm not the doctor for you.
Maybe I'm not the right physician.
I'm not the right, and it's happened, because, you know, because if the chemistry is not there, and it's just like, because if I'm walking to a room and I'm having a bad experience and I go into the next room, by the time I get to the end of the hallway, I'm having a horrible morning, you know?
And you don't want to do that.
And nobody wants to do that. But you know what? But that never happens to me, because whenever I go to the next room,
it's a positive kind of reinforcement.
Look who's here. Okay, well, what's wrong with this person, you know?
And I think that's a remarkable thing for physicians, you know, to have that kind of ability. And what you bring to that is kind of a joy too, you know.
Because I enjoy
as
what I do.
As you mentioned, you're a people person. Now, Doctor, unfortunately, we're kind of winding down here a little bit, but I wanted to spend a couple of minutes, you know, what do you want people to know, not only about, you know, their general health and what they can do as an internist for, you know, most of your life, and it is this new kind of innovative efforts that you have in holistic. What do you want people to know about, you know, how they should take care of themselves?
Well, the most important thing that we all need to do is to read a label and watch what you're ingesting. If you pick up a label and you can't pronounce it, and God forbid, you can't even spell it, it's not good for you, okay? Because that's the reality.
Rule of thumb, huh?
That's the rule of thumb. You know, just doing things, and everything is in moderation. You know, nothing is bad. You know, we have demonized cholesterol. Cholesterol is good. Without cholesterol, we die. We need cholesterol to make hormones. Now, it's all about moderation.
Exactly.
And do you need pills sometimes? Yes. If things have gone too far, there's no way of reversing it.
Exactly.
But I give my patients the option. I said, behind door number 1, you know, we could try this. You can try this supplement and see what happens, or we can go directly to a prescription drug. you choose. So I think that in the future, more and more of that is going to be the norm, because
That's a good point.
It's going to be the norm, because in any industry, in any science, it's all demand or customer driven.
And that's an interesting thing too, because now we have the concept of the millennials, and the millennials are going to be a driving force in the population.
They're informed.
And one of their key things is that they want that kind of concierge type of ability, to find out what their condition is and how to treat it immediately.
Well, what is happening is, as the generations are progressing, because of the magic of the internet, we have access to information that we never had before.
Correct.
So those who take an interest, and that's the other thing, take an interest in your health. Don't rely on someone to tell you this is what you have to do. You have to start somewhere. Okay, what do I need to do to be healthy? And guess what? No one's going to be healthy unless they choose to be healtzy. That's a good point. It starts from within.
That's an excellent point.
The journey of 1,000 of miles begins with the first step. Lao Tzu.
And that's a wonderful perspective to have. And one of the things too, even though you mentioned you wanted to become a pediatrician, I mean, in this country alone, childhood obesity is like an epidemic. And as you just mentioned, you have to choose to be healthy. Right. There are choices that families and individuals have to make, and it's not to say that you're not going to become ill or you're not going to have a condition,
no.
But if you choose a healthy path, sure. And the journey becomes a little less arduous.
And I mean, it is a travesty what's happening with our children and our teens. When you're having type 2 diabetes, which used to be called adult onset, now it's happening in
juveniles,
teens and juveniles, right? And again, what are they consuming? If breakfast consists of something that comes out of a Ziploc bag and out of a can, that cannot be healthy for you.
Right.
Our bodies were not designed to process FDC number 5, 6, and 7, okay? And and tripolyphosphate, which is put into some of the meats that we're consuming. And so, you have, all these chemicals that are being introduced into our food supply.
Right.
And guess what? And then we wonder, why is the cancer rate so high?
And sugar as well, I mean,
sugar,
large components of sugar included in everything.
Exactly. Sugar is a poison. It's delicious, it's great. Again, it's all in moderation. And corn syrup, they put corn syrup into anything. And here again, talking about cholesterol. A teaspoon of margarine, it takes over 16 hours for your body to metabolize it.
Really?
Yeah.
Wow.
Teaspoon of butter, less than 10. Because your body can process it. But when you can process it, something else happens. And even part of the obesity there's theories out there, and there's data to support it, that part of our obesity is due to toxicity. Because when there's a toxic chemical in our bodies and we can't get rid of it, what does the body do? Like a sponge, it holds on to it and it puts it into fat cells in order to eliminate it from the circulation. So as a result, we're creating all these fat cells to purge ourselves of the toxins.
Well, and I think the combination of diet, lack of exercise, bad habits and things like that, lend themselves to people's condition. So as a physician, when you see somebody that comes into your office and says, I'm having this or having this problem, it's years of non-healthy efforts that have resulted in that. And I think that's where you mentioned at the very beginning.
And it's funny, I'll end it with a joke. This is a true story. About 2 months ago, a patient of mine, he's been my patient forever. He comes in and he's really overweight and he wants me to tell him what to do to lose lose weight. So I sit there and I say, you know, Bob, this is what you have to do. You know, cut back on the carbs, this and that, and give a program. And they listen, well, why aren't you doing it? And I go, Bob, you're the one who wants to lose the weight, you know?
This is not my appointment, but that's an excellent, that's a great point.
You know, but the point being, it says, you know, I say, you're the one who's doing it. I mean, my cholesterol is fine. You know, my blood pressure is okay. I'm not a diabetic. Could I lose 40 pounds? Yeah.
Maybe.
Am I motivated to do it today? Not, you know. Anyway, but I just thought it was hilarious because, you know, you have to. Why aren't you doing it? And I do practice what I preach.
Yeah, of course.
You know, within parameters.
Well, you know, the thing is that and you know, obviously, you know, you bring a lot of not only focus and attention and care and detail to your practice and the people that you serve, but you also do that with a lot of joy and a lot of, you know, commitment and just an effort to be the best physician for your individuals. And what I would say, Dr. Arrojo, is I would welcome you back at any time, perhaps, you know, for a program where you can talk about some of these conditions and situations that arise, whether it's from a holistic perspective, or perhaps, you know, when it has to deal with conditions. You know, diabetes, huge thing. High blood pressure, huge, you know, issue in the United States. And there's a variety of different things. And I think with your combination of insight, knowledge, care, and experience, you could really bring a lot for information to this community. And I thank you for sharing some of your background with us today, and also have the opportunity to get a little understanding about the scope of, you know, things that are available for individuals.
And remember, never take no for an answer.
That's a really excellent thing.
Never take no for an answer.
Dr. Arrojo, thank you so much for joining us.
Thank you, Charles.
Thank you, and we welcome you back at any time.
Appreciate being here, as always.
And thank you for joining us on this special edition of Up Close on METV. And then we have the talk. Do this until they fade.